What fatty liver disease does to your brain? Have you ever blamed brain fog, forgetfulness, or trouble concentrating on stress, aging, or lack of sleep? What if the real problem wasn't in your brain at all? What if it was hiding in your liver? Most people think fatty liver disease only affects the liver, but scientists are discovering something surprising. A struggling liver may send harmful signal throughout the body, including to one of your most important organs, your brain. And the scary part, many people with fatty liver disease don't even know they have it. Today, we are uncovering what fatty liver disease may be doing to your brain, the warning signs you should never ignore, and why protecting your liver could also help protect your memory and mental sharpness. Let's begin. Fatty liver disease happens when excess fat builds up inside the liver. At first, there may be no symptoms, no pain, no warning, no obvious signs, but inside the body, changes may already be happening. Here is where it gets interesting. The liver is more than just a filter. It's one of the body's most important control centers. It helps process nutrients, regulate blood sugar, remove toxins, and support healthy metabolism. When the liver becomes overloaded with fat, these functions may begin to suffer. And when that happens, the brain may start feeling the effect. One of the most common complaints among people with fatty liver disease is something called brain fog. Brain fog isn't a medical diagnosis. It's a term people use when they feel mentally slower than usual. They struggle to focus. They forget simple things. They lose track of conversations. They feel mentally tired even after resting. But why would a liver problem affect the brain? Researchers believe inflammation may be one of the answers. Fatty liver disease is often associated with chronic inflammation. Inflammation doesn't always stay in one place. Chemical signals released by the body can travel throughout the bloodstream and influence other organs, including the brain. Some scientists believe this ongoing inflammation activity may affect attention, memory, and mental clarity, but that's not the only concern. Fatty liver disease is also closely linked to insulin resistance. Most people associate insulin resistance with diabetes. What many people don't realize is that the brain depends heavily on healthy energy regulation. When insulin resistance develops, the brain may not use energy as efficiently. Some researchers are investigating whether this could contribute to memory problems and cognitive decline over time. And what they found next was surprising. Several studies have reported that people with fatty liver disease may perform worse on certain tests involving memory, attention, and processing speed compared to people without fatty liver disease. This doesn't mean everyone with fatty liver disease will develop dementia, but it does suggest the liver and the brain may be more connected than many people realize. There is another hidden problem. Fatty liver disease often travels with other conditions known to affect the brain. High blood pressure, high cholesterol, obesity, type 2 diabetes, poor sleep. Each of these can place additional stress on the brain. When they appear together, the risk may become even greater. That's why brain doctors are paying more attention to what is happening outside the brain itself, because sometimes the earliest threats to brain health begin elsewhere in the body. So what warning sign should you watch for? Persistent brain fog, difficulty concentrating, feeling mentally exhausted, frequently forgetting names or words, trouble staying focused on simple tasks. Again, these symptoms don't automatically mean you have fatty liver disease, but they may be worth discussing with a healthcare professional, especially if you also have risk factors like excess belly fat, diabetes, high blood pressure, or abnormal liver tests. The good news, fatty liver disease can often improve, and many of the same habits that support liver health may also support brain health. Regular physical activity, better sleep, reducing excess sugar, managing blood pressure, maintaining a healthy weight, eating a diet rich in vegetables, fruits, healthy fats, and lean proteins. These habits don't just help the liver, they help create a healthier environment for the brain as well. And that brings us to one of the most important lessons from today's video. Sometimes the real cause of brain problem isn't the brain. It may be hiding somewhere else: the liver, the heart, the kidney, the gut, or another system quietly influencing how your brain performs every day. The human body is connected in ways many people never realize, and understanding those connections could be one of the best ways to protect your memory and mental sharpness as you age. Subscribe for more brain health insights. And before you go, ask yourself this: if a liver problem can affect the brain, what other hidden body signals might be influencing your memory right now?